This quick guide video provides an overview of how to insert a REM probe tube into an ear. Placement of the in situ probe is said to be the biggest hurdle in performing real ear measurements. This is because many clinicians feel uncomfortable fiddling around the ears of their patients. In fact, inserting the probe can be quite simple, and there are several methods of doing so in an easy way. Method 1. Estimating probe depth by otoscopy. In order for a probe tube to be inserted correctly, it should be placed between 3 and 5 mm from the eardrum. By performing otoscopy, one can estimate how long the ear canal is and take this into consideration when determining how deep the probe tube should be fitted. Method 2. Placing a marker on the probe tube. The average adult ear canal is approximately 30 to 35 mm long. Therefore, one can estimate ideal probe location by placing a marker on the probe tube. Probe tubes are typically manufactured with a slide marker. The probe tube can then be inserted until the marker reaches the intertracheal notch. Some public REM recommendations suggest using a marker of 27 mm from the end of the tube. Method 3. Observing the unaided gain curves. The unaided gain measurement provides a useful indication whether a probe tube has been inserted properly. A probe tube with proper insertion will produce an REUG which is 0 in both the lowest and highest frequencies. If negative values exist, then this informs the audiologist that standing waves are present and the probe must be placed deeper. Here are examples of both good and bad probe tube insertion as determined by the REUG. On occasions, you may find that the probe tube gets blocked with earwax or is placed against the ear canal wall. The easiest way to determine whether such a problem has occurred is to perform an REUG measurement. The REUG will show a very obscure measurement if this has happened. It is for this reason many clinicians include REUG measurements in their REM protocol even if the fitting method does not require it. With any new technique, practice makes perfect. By practicing on every patient and showing confidence no matter how many attempts are needed, you'll soon feel comfortable in performing this procedure. It is simply part of business that probe tube placements are often not straightforward, and it is absolutely fine to repeat the measurement. This concludes this quick guide video on how to insert a probe tube into an ear.